Alrighty. Good afternoon, everyone. Thank you for joining us today. Make sure we're ready to go here. Awesome. So today we're going to be talking about caution fatigue, and we have two awesome people joining us in addition to our interpreter, Lisa. And so yes, caution fatigue. We've kind of seen it in the media in the last week. I'm sure we are all feeling it very much. So first though, Dr. Sue, if you could go ahead and introduce yourself. Thanks for joining us today.
Sure, thanks for inviting me. My name is Albert Sue, and I am an OBGYN and infertility specialist at the University of Missouri. I am also president-elect of our Boone County Medical Society, and so I've been hosting weekly Zoom meetings with our public health officials and infectious disease experts for our physician membership. Earlier today, we had our 13th webinar, which featured a lively discussion about Medicaid expansion as a means to increase access to care and to help address social inequities and healthcare disparities.
Awesome. Well, thank you for making some time for us today. I know you've got a lot going on. And speaking of a lot going on, so does Verna, our health educator.
Good afternoon. I'm Verna LaBoy, health educator with the Columbia Boone County Public Health and Human Services, where I lead a wonderful health initiative addressing health disparities in the African American community called Live Well by Faith. And we're beginning to bring up some of our programs virtually. Most recently, though, they've added to my menu of work to be done is I'm operating as a COVID contact tracer.
That keeps you busy, I'm sure.
Yes, unfortunately.
Yeah. Well, so today, like I said, we're going to be talking about caution fatigue. So first off, Dr. Sue, what is caution fatigue?
Sure. So whether it's staying 6 feet away from everyone outside your family or mask wearing, caution fatigue is low motivation or energy or willingness to continue to comply with safety guidelines. This can also be associated with loneliness, anxiety, fear, depression, or sadness, really anything that can make any of us less interested or willing to follow public health recommendations. If you're up for a military analogy, imagine if your troops were on red alert all the time. You just simply cannot keep all that adrenaline up 24/7, 365, and over time, you'll simply lose your edge. We can compare caution fatigue also to burnout for health professionals. Another example is when our nurses and physicians work in the ICU, we hear all these machines beeping away, which is quite aggravating at first, but then over time, we just simply tune it out. One of my friends also calls this the radio station problem. If you hear the same thing over and over and over again on the radio, what happens? You just change the station.
That sounds fair.
So Verna, in your role as a health educator, how have you seen or how have you even felt some of this caution fatigue?
Well, I can see it in our community when we are just tired of the social distancing. We've grown weary of all the disinfecting and hand sanitizing and mask wearing, and it's summertime. It's time for barbecues, graduations, weddings, all the things that we're emotionally tied to. We're social beings and we're tired of sitting on the porch. So we want to party. We want to have a party. We want to turn the music up loud. We want to hug people that we've missed for months. And, you know, this disease, this virus is invisible. We can't see it. And if it hasn't crippled us or affected us personally, then we just want to go have fun. And that's what I'm seeing in the community we just recently, just Friday, it was Juneteenth in the African American community, and they wanted to celebrate badly. And trust me, they did. So, you know, that's where we see, you know, large groups. We see the spikes. We're beginning to see here the disparity numbers in our community, where African Americans are 9% of the population here, but we're creeping up to 30% of the positive cases. And that concerns me. And as a COVID contact tracer, I like to view myself as the coach. I'm there to walk alongside them through this 14-day quarantine process.
Yes, and we're so appreciative of you doing that for everybody. And you touched on it a little bit, but Dr. Sue, could you tell us a little bit more about why following, disinfection, social distancing, all of those things are still really important to do?
Absolutely. Someone recently asked me, Kay, is COVID still a thing? After all that wall-to-wall blanket TV, newspaper, radio, social media coverage of coronavirus since March, people are simply just getting sick and tired of hearing about it. And I've had countless people tell me that they suspect that they might have gotten it in the past, and so they simply hope that they might be immune. A few people have even confessed to me that they think they're invincible, and then also immediately saying they realize this is an unhelpful way to think.
Yes.
So what's unfortunate for folks who think they're immune is that the latest data here in Missouri shows that less than 6% of all tested individuals are positive for COVID-19 by PCR, and less than 4% of all tested individuals are positive for COVID-19 antibodies on serology testing. So the good news is that this shows that the physical and social distancing that we've been doing has actually been working quite well in Missouri, and it looks like our state implemented those stay-at-home orders just when it mattered the most. The bad news for those who think that they're immune is that the vast majority of us here in Missouri are not likely to be immune to the virus. So why is it important to keep social distancing and regularly disinfecting? Well, for most of you, it's not that you're going to get sick and die. It's really about being socially responsible. It's about protecting our elderly, protecting our first responders, and protecting our healthcare workers. Flattening the curve was, yes, partly about trying not to overwhelm our healthcare system, but it's also been about buying time to let our science and technology catch up to treating the virus effectively. Last I heard, there have been over 115 different treatments used to try to battle COVID-19. Every single day, we're learning more about this virus, and no, we haven't beaten it quite yet.
Exactly, yeah. We still, as heartbreaking as it is to admit to ourselves sometimes, we still have a long journey ahead of us. So let's talk a little bit about the ways we can combat caution fatigue. And Dr. Sue, if you want to go ahead and touch on that.
Sure. So regarding caution fatigue, probably the most important message is to maintain as much of a sense of normalcy as possible, despite all the chaos that might be going on outside. If you're used to going out with your spouse on a monthly date, please make sure you're still doing that, although this time it might just be a hike instead of a rock concert. Social distancing, to be clear, does not mean social isolation. In fact, as Verna said earlier, we are social creatures, and it's extremely important to stay socially connected while maintaining physical distancing in this pandemic. My medical specialty put out a statement a few months ago, encouraging everyone to reach out to old friends and extended family, to try to limit exposure to news and social media, to evaluate whether contacts like Facebook groups and others are actually helpful or not, and to really limit your contact with people who upset you. Practice gratitude, take time to enjoy something you do every day, lower your expectations of yourself and others, and really be patient and kind with yourself and others. Exercise is important, as is avoiding unhealthy habits. So yes, listen to the weather, listen to the traffic report, but don't necessarily engage with the news media, and social media every single day when it's all about COVID and COVID complications.
Yeah, thank you for sharing those tips. I know personally here, I do a lot of the social media stuff. And so at nights and on the weekends, I have to just put the phone away, put the computer away, and not be constantly checking and reading, because it can be kind of overwhelming. Verna, what are some ways you've kind of combated caution fatigue?
That's exactly what I've done. I hardly ever turn the television on, maybe just to get the 6 o'clock news. By 10 o'clock, I'm asleep. I'm making sure I get a good night's rest. And, you might want to have a couple of news outlets that you trust, that are scientific in nature, and stop following all the rumors. And it just gets overwhelming. You'll go down a rabbit hole quick and get consumed. I was finding myself crying a lot last week. There was a lot going on, not just with the pandemic, but the Black Lives Matters protest and the police issues. And it was just overwhelming for me. And I've never been that emotional before. And so it was just overwhelming. So I reached out to the employee assistance program. The coach needed a coach. So what I want people to really take away, one of the takeaways is don't be afraid to ask for help to help you get back as much on track as you possibly can, and do things to practice self-care. And I wasn't doing a good job of the self-care at all. So, these are unprecedented times. We've never lived through anything like this before in our generation. So we cannot get lax or grow weary in taking care of ourselves. My 80-year-old mother lives with me. So I haven't hugged my mom since we've come home. I keep my distance even in the house with her because I'm still going and coming in the public from time to time. So I do not allow grandchildren and great-grandchildren that come for social distancing front porch visits to embrace Granny or me. It's tough because the littles just want to run up to me and they don't understand why I'm putting my hand up. No, you can't do that right now. And it's heartbreaking. And it really got to me because with all that's going on, we can't go to our places of worship. All the places that I went to get my spirit fed, my soul fed, or my fellowshipping, because I'm an extrovert and I'm also kind of an empath. So I'm just really getting it right now. So I just want people to really understand that we want to arrive healthy at the end of the day, at the end of the year, at the end of the decade, if we're blessed to live that long. I don't want to have to go through, some people go through the positive diagnosis asymptomatic, and that's wonderful. But there are many who don't. And it's really hard to, for them and for the family to isolate and stay distant and disinfect. And when you have to stay in a room for 2 weeks because you've tested positive. So what I tell my family is assume everybody's positive, because sometimes people don't want to isolate when they've been told to stay isolated and quarantine because they don't feel any symptoms. They want to do what they want to do. And so you have to be aware, be cautious, disinfect. I usually wear hand sanitizer around my neck. I still have disinfectant wipes in my vehicle. I have plastic gloves when I'm filling my gas tank. It has to become a healthy habit. You cannot grow lax in the self-care part and protecting yourself.
Absolutely. And I had a really good conversation with someone yesterday about it's really just every decision you make at one day at a time. Focus on, okay, what can I do that is protecting me, but also everyone around me when I go to the grocery store or when I go get dinner or something like that. Every time you just have to actively make choices that are taking everyone's health and safety into consideration. Through all this, I think it's pretty natural to want a light at the end of the tunnel or a day like this is going to be over then. But because this is a new virus, we don't necessarily know. But based on what we do know, Dr. Sue, how long can we expect to be taking these extra health precautions?
So I want to start with a positive message. The amazingly good news is that here in Missouri, we've really been blessed with a low prevalence rate. And this is in part because we're in the middle of the country, and in part because we have had excellent state leadership with a robust public health response, including mobile testing, contact tracing, and really a high level of transparency by our state health department. Our state started to open up way back on May 4th. And one of my children is playing in Daniel Boone Little League, and we had our third game yesterday with lots of careful and thoughtful physical distancing precautions. Now, as you may have heard about in the news, several states on the East Coast have only just started reopening the past week or two. So in answer to the question of how long we should expect to keep taking these extra health precautions, I would honestly continue to exercise really good hygiene, really good physical distancing until we achieve herd immunity, which unfortunately will probably be several months after a vaccine is available. Again, the good news, in my opinion, is if we continue to do a really good job with hand washing, good hygiene, physical distancing, and not going to work and school when we're sick, then hopefully we'll have a much less severe flu season this fall than we did last year when 40 million Americans got influenza. Now, many public health experts and infectious disease experts are predicting another wave of COVID-19 cases this fall. Now is the time to be accessing healthcare, to get preventative healthcare, cancer surveillance, and elective surgeries taken care of. Our hospitals are open, safe, and ready. So if you need medical care, please contact your healthcare provider or go get a telehealth visit.
Awesome, thank you. I'm not seeing any questions from commenters right now. So I do want to ask you both, I am 25 years old. I'm in this group that may not necessarily be at high risk for COVID. What would you say to me and people like me to encourage them to continue doing these mitigation efforts during the pandemic?
Well, what I'm saying to my family, because as of next month, my husband and I will have 21 grandchildren. And so I have them all ages, and they're not, really understanding the social distancing, the need for it, because they feel great. It's summertime and they want to have a good time, and they're doing it. So as a result, I am social distancing us, the grandparents and the great grandparents. So I would just like them to consider that because they're young and feel invincible, they could very easily carry the virus to the vulnerable populations that maybe not be able to handle it as well because of the comorbidities, all the other underlying health issues that they're already trying to manage. So to be considerate that it's not about you, it's about people that you love and people that you care about. So please be considerate, wear your mask, practice social distancing, and just be protective of others, because it isn't just about you.
Dr. Sue, do you have anything to add to that?
Yes, so I want to be clear to really everyone that we're not saying not to have a good time. We do, part of keeping sane, part of keeping healthy during this pandemic is to do things that you enjoy. But I agree with Verna, it's all about social responsibility. Think about the frontline workers. Think about emergency medical services, the paramedics, the firemen that we depend on to take care of us in emergencies. We don't want to burn them out. We need to take care of them. And so we can hang out. Our, Memorial Day barbecue was an event which we held outside, and everyone tried to be careful about staying 6 feet apart. And some of us, like me, who's a healthcare worker, I wore a mask to try to avoid spreading anything to anybody else there. And so really, we want to protect our elderly, protect our healthcare workers, protect our frontline workers. The cases will continue to go up. This is what viruses do, but we want to try to keep a low level of cases here so that we don't have to start shutting down again. And so there even is some self-interest here where the more you help protect everybody else by keeping the 6 feet of distancing, whether or not you're wearing a mask from anyone who's outside your family, and wearing a mask when you are outside and can't help being in contact with others, it's really helping to keep everybody safe and keeping us at a low prevalence level.
Absolutely. Well, thank you so much for joining us today, both of you. I say this every time on Facebook Live, but I feel like even I learned something after we all talk. So I really appreciate you both being here. And we will be back on Friday with another Facebook Live for everyone. Thank you.
Thank you.
Thank you very much.